Okay, thank you everybody for coming this evening, and I'd firstly like to start by acknowledging the Aboriginal people in Torres Strait Islands as this country's First Nations people. We recognise First Nation people and communities as traditional and cultural custodians of the lands on which we work to provide safe and quality health services. We pay our respect to elders past, present and emerging. And just for those of us that work for Cairns HHS, just recognising our shared values of compassion, accountability, respect and integrity. Good, the lights are going down. Good. Okay, so welcome everybody. My name's Angie, or Angelina Boswell, as you probably know me on emails. In this auditorium, lots of you have probably been here before, but if you need to go to the bathrooms, you just go back down that corridor that you walked in through, and if you turn right, the bathroom's on the left-hand side. And for the fire escapes, again, you go back down that corridor and there's fire escapes to the left or down to the right where the lifts are. This session is a live Teams event, so it is being recorded, and the recording will be uploaded onto the Primary Health Network's website probably early next week. And because it's recorded, we just like to keep the questions to the end, just so that we can keep the chat going for the recording. I'd just like to say thank you to the North Queensland Primary Health Network, who are here tonight, who've set up all the invitations. They're going to organise the certificates, so for the certificates you'll have to fill out the feedback form. They're going to email, I think there's a QR code actually, and you'll have to scan the QR code and then they'll email you the certificates. And Queensland Health Network are also here tonight and provided the food and helped set the event up. And then I'd also like to thank Raj again from CHIDS IT, because without Raj, I'm not very good at IT, so thank you. So the objectives tonight is we're going to look at the 2023 influenza programme. The COVID update will just be very short because COVID's not really part of the NIP, and it's more about the NIP schedule, the presentation this evening. I'm just going to go through the National Immunisation Programme just to go through an update. Just we're still finding that certain vaccines aren't being given who people are eligible for. So I just wanted to go through all those additional vaccines that people can receive. And then Nancy is going to present some cold chain management information towards the end. And then at the very end, we'll have the questions. And then if you could make sure you scan your QR code for the questionnaire, for the feedback questionnaire. So I'm here with most of my team is here tonight. We've got our director, Dr. Richard Gare. We're part of Tropical Public Health Services Disease Control. We're part of quite a big unit that includes, environmental health and disease surveillance, and that's in the middle there. That's the sort of twice yearly magazine that tells you all about everything that Tropical Public Health does. But for me, I'm in the IMS team with Karen Connors, and our data officer is Kathy Lort-Phillips, and we're the people that you usually speak to when you call with your immunisation questions. And then we also run a project, Connecting Our Mob, which is, that's Nancy is running that project at the moment with Kathleen Lockwood, and she has a data officer. And then Communicable Disease Control is Juliet and Carly, who you probably know, have been in the team for quite a long time. And we have a public health registrar, Tonya Markpetz, who's with us tonight, Dr. Tonya, and Annie Preston Thomas isn't with us this evening. She's the other public health medical officer. Oops. So we're just going to talk about the flu for 2023, but we'll have a quick look at last year. So in 2022, there was a resurgence of the influenza, and that was sort of arising from the reopening of the international borders and, well, just state borders as well. And last year, children younger than 5 years had the highest influenza notifications, with only 32% of that cohort receiving a vaccine. And this rate of vaccination was even lower for First Nations children at 21.5%. This is a letter that came from the Chief Medical Officer, and in this letter they also raised that pregnant women are also more than twice as likely to be admitted to hospital with influenza than non-pregnant ladies. This is a graph of, it is Cairns HHS, and this is confirmed by the lab confirmed influenza. And this graph starts from 2012 up until 2023. And it shows like the backgrounds of the flu rates in CHIS from what we've sort of described as being the normal years in 2014, 15, 16 and 18. And then in 2017 we had the big outbreak. And then in 2019 we had another outbreak, and we tend to get 2 outbreaks in this part of the world. We'll often have one, and that will go back to normal, and then we'll end up having another peak later in the year. And then during early in 2020, 2021 until into 2022, because of COVID-19 and border closures, no international travel, social distancing, all those things, we hardly saw any flu at all. And then early in 2022 was what has been called the catch-up year. So a lot more lab notifications, but we just also have to take into consideration that a lot more people were also being tested as well, because people are keen to know whether they've got COVID or whether they've got influenza. And then in 2023, we've got a peak already, sort of a relatively high first peak compared to normal years. And we'll just wait and see what happens. But we're obviously very keen to push vaccination and ensure that anyone who's eligible for a vaccine receives one, to discuss vaccination with people who don't fit into the eligibility criteria. They can purchase flu vaccines privately. So you can still have those conversations, even if they're not in the funded group. So the vaccines this year, it's always it's same as previous years. We've got 2 A strains and 2 B strains, so they're quadrivalent vaccines, and we've got egg-based vaccines and cell-based vaccines. And it's just the A strain in both of the vaccines that has changed. So this year we've got the Sydney like virus, and previously with the egg-based, it was a Victorian, and the Wisconsin with the cell-based. So not a great deal of changes there. So for this season this year, the documentation that you're going to receive is a little bit different. So the Queensland Immunisation Programme, they're not developing or printing Queensland specific influenza vaccine material. So what you've got here is the Commonwealth that the whole of Australia receives. And this is what you're going to get now, which is a shame, because we used to get quite a nice poster with boxes of the vaccines and eligibility. And that is what that is up there. So it's we've actually had a little play, and we've made some a bit bigger because they are handy to have next to the fridge, so you can eyeball it quickly and see who's who for which vaccines. But I'm not quite sure why it is, but Queensland aren't going to be producing any of their own documents. So hopefully everybody's got these. They are downloadable online, and we've got quite a few here, but hopefully you've all been sent a package with all of that in there. And then we hope that everyone has got the ATAGI statement, and this is the one that gives all the clinical advice and all the eligibility. It's a really important document when you're giving out the flu vaccines for your flu season. It's kind of a go-to. Ideally, we want you to have that, the previous document that I just showed you, and then have access to the handbook. And hopefully that's everything that you should need to answer all your flu vaccine questions. So I've just enlarged the section from over there. I've just enlarged it here. So in the funded section this year for children under 5 years, there will be Vaxigrip and Fluarix Tetra. Children from 5 years can have a Fluariquad. And then for everybody else between 5 years to 65 years, they can have any of those vaccines, Vaxigrip Tetra, Fluarix Tetra, or a Fluariquad. For our over 65s, it's the Fluad Quad, which is the same as previous years. And then the other vaccines that don't have the yellow box that says funded, they may well be in your fridges anyway, because they're what you can purchase privately. So a lot of GP clinics purchase their own private vaccines, or if the patient goes to pharmacy. So they're the vaccines that you may see in the private markets. And as I said, do encourage people who aren't eligible to still try and get a flu vaccine if they can, especially if they're travelling overseas. So that's the previously that was a really nice poster with the Queensland Health Immunisation Programme. So that's what you've got, which you need to be keeping near your fridges and where you're drawing up your vaccines. And it just, again, it shows Vaxagrip Tetra and Fluarix Tetra for the children from 6 months to 5 years. And then we don't give a Fluariquad until they're 5 years of age, and 65 and over the Fluadquad. So do be careful, because the boxes do look quite similar sometimes, and we do see errors where the vaccines are given, like we've seen Fluadquads given to children before. So just make sure you always double check which vaccine you give him. So this year, all the vaccines are quadrivalent. They're all 0.5 ml intramuscular, so no half doses. We haven't seen that for quite a few years now. All the funded vaccines are latex free, and egg allergy, it's not a contraindication for influenza vaccines, but if there is significant concern from you or from a patient, then just ensure that the vaccine's administered in a primary healthcare setting and that they wait 30 minutes rather than the 15 minutes. Check your fridges, just make sure that you discard any vaccines from 2020, and hopefully by now you've already done this, but just check you've got plenty of space in your fridge. It's not good storage if your vaccines are all crowded. So I'll just go through the eligibility, which we're lucky it's not changed from last year. So it's going to be, you can't give a flu vaccine to anyone younger than 6 months. So it starts from 6 months. And then it's going to be for people for 6 months and over with certain medical at-risk conditions, children from 6 months of age to less than 5 years, people aged 65 years and older, pregnant women, and all Aboriginal and Torres Strait Islander people who are older than 6 months of age. So for the medical conditions, these are listed in your ATAGI statement. They're listed on this document that I keep talking about, that the Queensland Health Programme should have sent you all, because they're not doing their own, and also in the Australian Immunisation Handbook. And the diseases that put you at risk of influenza, they've not changed. So it's still cardiac disease, chronic respiratory, chronic neurological, immunocompromising conditions, diabetes and metabolic disorders, hematological disorders, and long-term aspirin therapy in children aged 5 to 10 years. So take the time when you're doing your consultations to check to see if somebody's eligible, because these people are at particularly high risk of influenza and the illnesses that you can get from influenza, and you should have access to that information in all those different documents. Children from 6 months to less than 5 years. So children aged 6 months to less than 5 years are at higher risk of complications from influenza, and even healthy children can get quite seriously ill, which we have seen before. So don't just assume that it's children with immunocompromised. So we give 2 doses are recommended in the first year of receiving the vaccine, but if after that you only give 1 dose for subsequent years. However, if you only gave 1 dose in the first year and they come back the second year for the vaccine, you don't make the second vaccine up, they just continue to have 1 dose yearly. And I think patients, parents get a little bit overwhelmed by the amount of vaccinations that their children get. So do take the time to discuss the influenza vaccine with parents. And then the sharing knowledge about immunisation from the NCRS, they do have some quite good documents that you can read and share with parents, because I had a chat at an education session the other night, and a few people say that parents are just, they have enough vaccines, I don't want to give them anymore. So if you can spend time educating but consulting, generally people like to receive their advice from a nurse or a doctor, and that's when they'll have time to think about it and may change their mind. But people like to be informed, so these documents are pretty handy, or you can just refer them to the website. It's got lots of other resources about vaccine hesitancy. This website has, it's very good. And then people over 65 years of age. So this group are at high risk of complications from influenza, and we're very keen to ensure that everyone in this age group is vaccinated. It's recommended that this age group receive either the adjuvanted or the high dose. Now it's the Fluadquad here, which is the funded vaccine on the schedule. So that's what most of you will see in your fridges. However, there is one on the private market called Fluzone, and that is available from the age of 60. So it can only be purchased privately, and it is good if you've got someone in their 60s who's heading off on a cruise and they're too young for the Fluad quad and they want to protect themselves well, or traveling overseas or high risk for any other reason. This vaccine is available, but it is private, so it will have to be paid for. And because these vaccines are high dose and adjuvanted, there is higher risk of injection site reactions, and we have seen that. We have seen aphids coming through from injection site reactions from these vaccines, but it's not a reason to not vaccinate again the following year. So the high dose vaccines, they can be co-administered with Prevnar 13, Pneumovax 23, the COVID vaccine and Zostavax. But there's limited research on the adjuvanted or high dose vaccines being given with the new Shingrix. So Shingrix is only available on the private market as a shingles vaccine, but they at the moment they're not committing to say that they're okay to be given together. There's a little section on the ATAGI statement for Zoster that talks about that. So it's preferable to separate those two vaccines by a couple of days. So in pregnancy, it's recommended every pregnancy, and flu vaccine, it can be given at any stage of pregnancy. And it's okay to be co-administered with Boostrix and Adacel, and it can be co-administered with the COVID vaccine as well. So if you have someone who's already received, if they're pregnant, they've already received the 2022 influenza vaccine, and during their pregnancy, the 2023 influenza vaccine becomes available, then they should receive that. So they could potentially have two flu vaccines in one pregnancy. And if someone receives if the 2023 vaccine is received before somebody gets pregnant, they should be revaccinated during that pregnancy with another dose of the 2023 vaccine. And this is to maximise the protection of the mother and the infant for the first 6 months of life. So they could again receive two flu vaccines. Aboriginal and Torres Strait Islands. So the disease burden from influenza is significantly higher among Aboriginal and Torres Strait Islander people than non-Indigenous Australians in all age groups. So all Aboriginal and Torres Strait Islanders from 5 years up to 65 years are eligible for the flu vaccine. So for Aboriginal and Torres Strait Islander children, you just follow the children's schedule of the Vaxigrit Tetra and the Fluarix Tetra from 6 months to 5 years of age. And then for older Aboriginal and Torres Strait Islander adults over 65 years of age, you would ensure that you give the Fluad quad. And that is definitely from 65 years of age. We do get asked sometimes if it's from 50, and I think that's because the Prevnar is given at a younger age, but the Fluad quad, it is only licensed from 65 years of age, so you can't give that any younger. And we printed off a couple of these documents. It's the Sky sharing knowledge about immunisation. Have done a whole suite of resources around influenza for Aboriginal and Torres Strait Islander families to read. They are quite wordy documents, but there's a whole suite of them. You can access them online. So resources for flu, for influenza. So the web page at the far end is the Queensland Immunisation Programme's web page, and that has most of the information that I've just talked about on there and links to other resources. The ATAGI statement is really important. Make sure you've got a printed copy of that or access to it. The information for providers pretty much has a lot of the same information as well. And then we didn't bring any of the NCIRS, but the NCIRS every year updates. They have a fact sheet, and then they also have a frequently asked questions. And the frequently asked questions is really good. It'll often answer some of your curly questions that you might ring us about. We sometimes just hop onto the NCIRS and it will already have answered them for you. So they're pretty handy to have all these things printed on your desk during flu season. And then, of course, at the bottom over there is the Australian Immunisation Handbook, which is updated every year with all the latest flu information, and everyone should hopefully be pretty familiar with using the online version now. It's a long time since we had the book. So, a sip of water. I've only got a few slides on COVID vaccination, and we're just going to talk about the booster. So influenza vaccines can safely be given at the same time as COVID-19 vaccines. If your service isn't administering COVID-19 vaccines, just go onto the Clinic Finder. I don't think we have quite as many GP services administering the COVID vaccine as we used to. Clinic Finder, you can just sit with your patient, type in which vaccine they need, postcode, and you can work out where it's been given. And there are a lot of pharmacies that are giving COVID-19 now. And ATAGI recommends a 2023 COVID-19 booster dose for adults in certain groups. And if your last COVID-19 dose and your last COVID-19 immunisation has to have been greater than 6 months, and it also has to have been greater than 6 months since you've actually had the COVID-19 infection. So whichever is the most recent, and regardless of the number of prior doses. So we're moving away from the booster dose 4, boosted, and the 4th dose and 5th dose. We're not talking about doses anymore now. It's just we're talking about a booster. And so if it's over 6 months since their last vaccine or their last infection, they're eligible for a booster dose. With COVID, it's very hard to keep up with everything. It has been managed as a Commonwealth programme rather than through the Queensland Immunisation programme. So we've had little involvement over the programme, and for us and for all of you, my biggest recommendation is just to hop online, because everything changes so quickly with COVID. So if you go online, the ATAGI statement's got all the advice for the booster dose, and then if there's also an ATAGI statement all about the doses and administration of COVID vaccine. And things can change within a few days with COVID-19, so I would always check online. This is the most recent documentation that has come up, and this just nicely explains eligibility. So for under 5s, it's not recommending boosters. If you've got risk factors between 5 and 17 years, ATAGI advises you should consider a booster if you've got risk factors, but otherwise no. 18 to 64 years, again, it's only for risk factors, but you can consider a vaccine, and that's when it's important to have conversations about, are you travelling overseas? Do you work in a high risk area? It's just important to have those consultations about whether somebody is eligible or not. But for 65 years and older, they're definitely recommending COVID-19 boosters, and that's when you've just got to make sure it's over 6 months since their last one and over 6 months since they've had any COVID infection. This is just the ATAGI primary course advice, and we've printed a few of these off, but I don't think it's worth printing anything off with COVID, really. I think it's important that you just always hop online with that. That's as much as I'm going to say about COVID, but if you've got any questions at the end, you can ask us about that. So what I wanted to do was just talk about the National Immunisation Programme. We're just finding that certain Aboriginal and Torres Strait Islander vaccines aren't being given, or certain medical at-risk conditions, a vaccine aren't being given, and it's a big, complicated schedule, and immunisation rates have been low. So we just thought if we go through the schedule, might just refresh everybody. And this is data taken from the Australian Immunisation Register in 2022. And the bits that are in yellow are Cairns HHS, and it's been broken down into quarters and into years, 1 year, 2 year and 5 year. And obviously, I think most of us know that to get herd immunity, you need 95% immunisation coverage. And that's what the government aims for Australia, to have 95% coverage. But that's immunisation rates have dropped quite a bit, and you can see from the Indigenous figures here, we've got some as low as 86, 83%, 89, 88%. We generally find that by 5 years of age, a lot of children have caught up into the mid to high 90s, more sort of, well, in the 90%. That tends to be because around 5 years, we're sort of looking at children starting school and Centrelink payments and other things issues come into play. And that's good that the children are sort of caught up by 5. But unfortunately, the children who are at 1 year old and 2 year old, there are young little infants and babies that are vulnerable, and that's the age group where we really want to get vaccination rates up. The Chief Medical Officer has recognised this, and he says there is cause for concern as delayed or missed childhood vaccination has become a pressing problem globally, with some of the largest declines in rates seen in decades. Unfortunately, Australia has also been affected by this issue, with concerning downward trends observed in childhood immunisation coverage rates over the past 2 years, particularly in First Nations children. And the research has been done, and research has shown that parents are now likely to hold negative perceptions towards childhood immunisation. And it's due to the focus on COVID-19, there has been reduced awareness about the importance of all the other childhood vaccines. So the Department of Health has recognised this, and they're planning to undertake promotional activity in April 2023, reminding parents of the importance of timely completion of childhood schedule. And timely is the sort of the crucial thing there, really, because we could see that a lot of kids are caught up by 5 years of age, but it's the 1, 2, and up to 5 we want those kids caught up as well. So you may start to see a whole suite of new resources coming through. We'll keep you updated and email them out if we get them. So this schedule's been around since 2020. Everyone has probably got used to it now, but it was a pretty complicated schedule to get used to begin with. So the one on the far side over there is the childhood schedule for children under 10. And it's all the vaccines for those children under 10 that are listed on that schedule. They're the only vaccines that can be given to those children. So you can't pick vaccines from the adolescent schedule and give them to children, or you can't give the children's schedule vaccines like an Immunisation to an adolescent. So that's the childhood schedule on the far side over there. And then this is the adolescent to adult schedule. And it lists all the other people who are eligible for vaccines in the first half of that document, and it includes the adolescents. And then in the purple section down here, it has medically at risk. The green section is the influenza, and in the little blue box here, it talks about refugee and a humanitarian entrance. And just under the purple section, it talks about the school immunisation programme as well. So I'm just going to go through a few of those because it's a lot of information on 2 sheets of paper there, and it's just knowing how to access and interpret some of that information. Oh, and I'll tell you what I did mean to mention as well with the previous slide is my little box up there. Do stick to the schedules. Don't let parents make up their own schedules. You know, it is mapped out for a reason. You can't sort of decide to give half doses or not reconstitute certain vaccines because you don't want them to have certain aspects of it. And you can't sort of, if you think a teenager's due polio, you can't sort of give them an Immunisation or something. Please do definitely stick to what's written in those schedules. And I'm not going to go through these, but these are just what the Commonwealth schedules look like. So the previous one was the Queensland Health schedules. And this is what the National Immunisation Programme schedules look like. So that's all the children under 10. This talks about adolescents and other adult vaccinations. And then it's got the medical at risk. So it's similar information, it's just laid out differently. But for now, we just follow the Queensland schedule. So most recent change is the Gardasil 9, which is now a 1-dose schedule. There is a catch-up now for people who missed the vaccination. It has been extended to include up to and including 25 years of age. So as soon as you turn 26, you're not eligible for the free Gardasil. Any dose given previously is considered a valid dose. That includes doses of Gardasil 4, which we used before Gardasil 9. If you're 26 years and older, the Gardasil is a private script, and you will need the old 3-dose schedule of 0, 2, and 6 months. Anyone who's immunocompromised does still need 3 doses of Gardasil 9 at 0, 2, and 6 months. And if they're under 26 years, those 3 doses are all funded. So this is the document that you should have all received, the fact sheet, and that talks about the single dose and that there is now a catch-up programme. And with the catch-up, it wasn't introduced for boys to have Gardasil until 2013. So there will be some boys or men in their sort of 24, 25-year age group that were never offered Gardasil during their school years. So if you're getting guys around that age coming into the practice, try and find the time to have a chat about this vaccine. It's, you know, it is an expensive vaccine, so it'd be nice if they could get the vaccine while it's still free. I'm gonna say that's it. But if you could then go and err and you find that they've already had one dose years before, it is included. It is counted. So one dose is all that you need. So I've just done a scenario here. So any doses previously given are considered valid. So for example, if you've got a 15-year-old who had one dose of HPV in year 7, age 12, and they're now at your clinic for the meningococcal ACWI, and they remembered, oh, I only got this one dose of HPV, can I have that second dose today? They're not eligible. They've already had it. One dose is all they need, and they won't be needing any more. So it has made that easier, really, that it is just one dose. It's just going to take a bit of getting used to. Okay, that's the Gardasil. So I'm just going to go through what's funded. So there's medical at risk conditions, there's Aboriginal and Torres Strait Islander people are funded for additional vaccines, pregnancies funded additional, older adults, humanitarian entrants and refugees, there's a whole school immunisation programme, MMR vaccine, hepatitis B in certain groups, and I'll talk a little bit about catch-up vaccines. So for people who are medically at risk, there are additional pneumococcal, meningococcal B, meningococcal ACWI and Hib vaccines. And there's an ATAGI statement that came out in 2020, and that one is still the statement that we're using now. And there's two that came out, one for medically at risk, all the vaccines, and one specifically for pneumococcal. So with pneumococcal, any children, if they're medically at risk, they are eligible for extra doses of pneumococcal vaccine, and those medical at risk conditions are listed on the back of the ATAGI statements here, and the ticks are anyone who's recommended, and then the shaded boxes tell you which vaccines are funded. So if you've got a child that's medically at risk that fits those conditions down there, they need to receive an extra Prevnar 13 at 6 months of age, and then when they get to 4 years of age, they get a Pneumovax 23, and then they'll get their second Pneumovax 23 5 years later. So that's for your children. So if they fit in that criteria, please ensure that they get their additional pneumococcal vaccines. For adolescents and adults, if they develop a medical at risk condition, they get a Prevnar 13 at diagnosis, and then 2 to 12 months later, you give a Pneumovax 23, and then 5 years after that, they get another Pneumovax 23. Only 2 doses of Pneumovax 23 in a lifetime, and those conditions are all listed there. Just babies born less than 28 weeks gestation, that does get missed sometimes. They're additional, eligible for additional doses of pneumococcal vaccine as well. This thing here is called the decision tree, and that really helps if you've established that someone fits into the medically at risk criteria for pneumococcal. Then just go over to the decision-making tree. It'll tell you what age they are, whether they're medically at risk or Aboriginal or Torres Strait Islander, and then it just tells you how many doses they're due. So it's the 2020 document, but it's still what we're using today, and that's the best document that tells you about eligibility. You can also find out from the Australian Immunisation Handbook as well, but that won't tell you who's funded, though. It'll just tell you who's recommended. And then there are they brought out in 2020, these are all schedule changes that happened in 2020. Meningococcal B, it is for certain medical immunocompromising conditions, you're eligible for additional doses. For young children, they can get up to 4 doses. For over 12 months of age, they get 2 doses, but it's quite a small amount of immunocompromising conditions. So you really have to read through that ATAGI statement. So, but if you have got a child with a real immunocompromising condition, make sure that you make sure they're not due additional vaccines, because they may well be due Bexsero and Nimenrix. I know they're getting Immunisation at 12 months anyway, and Aboriginal and Torres Strait Islander kids will get the meningococcal B, but if they're medically at risk, they will get additional doses. And if they're only that little, and they're very vulnerable, so we'd like to ensure that they get caught up. And then they've made Hib vaccines funded in 2020, which is great. That's for the asplenia and hyperasplenia patients, and that is also listed on that ATAGI statement for medical at risk. So we are going to send a resource list email to everyone who's attended, so you know all these different documents that we're talking about. The Aboriginal and Torres Strait Islander people are eligible for additional vaccines, and that is the pneumococcal. So it's the same as medically at risk actually. For infants and children, they'll get an additional dose at 6 months of Prevnar 13 and then Pneumovax 23 at 4 years of age. And then Aboriginal and Torres Strait Islander adults receive a Pneumovax 23 at the age of 50, and then a Prevnar 13 at the age of 50, and then a Pneumovax 23 2 to 12 months later, and then dose 2 5 years later. You may well find that this age group potentially had Pneumovax 23 already, and if they had, you have to include those doses. So if they've already had 2 Pneumovax 23, you're only going to give one Prevnar 13. Some patients have had more than 2 or 3 as well, but it is only 2 in a lifetime. And if you give Pneumovax 23 first, which you shouldn't be doing, it should be Prevnar 13, but if they've had Pneumovax 23 recently, there has to be 12 months from Pneumovax 23 to give him Prevnar 13. Whereas if the other way around, if you give him Prevnar 13 first, it's only between 2 and 12 months before you give the Pneumovax 23. So with meningococcal, it's only the babies, the children under 2 years, that are eligible for that vaccine, and it's Bexsero, meningococcal B. And that's given at 2, 4 and 12 months of age. And once they're over 2, it's not funded. And this is where we've had quite a lot of errors with that schedule that I showed before. It was never clear. It does look like Aboriginal and Torres Strait Islander babies should get a dose at 6 months, which they don't unless they're really immunocompromised. But it's just the way how the schedule is written. I think everyone's got used to it now, but we do still get a lot of Bexseros being given at 6 months of age. But unless they're immunocompromised, you only give Bexsero at 2, 4 and 12 months of age. And if they start it over 12 months of age, you only get 2 doses 8 weeks apart. Hepatitis A has been on the schedule for the Aboriginal and Torres Strait Islander children for a long time. They just changed the timing of when the vaccine was given. So it's given at 18 months and 4 years of age, which you should be used to. Have done that for a while. And they can be caught up until just before they turn 10. So once they turn 10, they fall into the adolescent schedule, but under 10, they're in the childhood schedule and you can catch up the hepatitis A. And then for influenza for Aboriginal and Torres Strait Islanders, we've just talked about that all are eligible from the age of 5 years to 65 years. And then obviously all children would be getting the flu vaccine anyway. Pregnancy, it's not changed. So diphtheria, tetanus and pertussis, so which is either your Adacel or your Boostrix, it's funded from 20 weeks gestation. So the ideal is to administer it between 20 to 32 weeks, but it can be given later in pregnancy. It can be given right up until the end of the pregnancy. And vaccinations recommended with each pregnancy to protect the mother and the newborn baby. And if they get pregnant, within a year of giving birth, you still would give another Boostrix with the next pregnancy. And influenza can be given at the same time as Boostrix and Adacel if we need to, and that influenza should be given every pregnancy as well, which we've just talked about. So for older adults, the pneumococcal vaccines, that changed a few years ago because we always used to give the Pneumovax 23, but in 2020 that changed. At 70 years of age, regardless of how many doses somebody might have had of Pneumovax 23, all older adults should have a Prevnar 13 to get that protection from the Prevnar 13 vaccine. And then if older adults who are Aboriginal and Torres Strait Islanders, they get that Pneumovax, they get the Prevnar 13 at 50 years of age, and they'll then go on to get the 2 doses of Pneumovax 23. So pneumococcal vaccines appear in a lot of the additional schedules. And then for older adults, the Zostavax vaccine for shingles is due at 70 years of age, and there's been a catch-up programme for quite a long time now for catching up the 71 to 79-year-olds. They did extend it a few years ago. It's been extended to October 2023. And any Zostavax vaccines that you're given, remember that it's a live vaccine. It's 14 times stronger than your standard varicella vaccine, and you have to be you can't give it to anyone who's immunocompromised. So you need to check what conditions they've had. And there's the tool here. It's on the Australian Immunisation Handbook, and I would just recommend that anyone giving a live zoster vaccine uses the tool before administering the vaccine, just to be absolutely certain that because of the strength of that live vaccine, we want to know that that person's fit and well. And then older adults, I've already talked about this, they're eligible for the adjuvanted fluad quad vaccine from 65 years of age. That's what's funded. And then the note at the bottom, it's not funded, unfortunately, but older adults often haven't had a tetanus or pertussis vaccine for a long time. But if you are getting an older adult that's asking for a tetanus vaccine, always try and have a conversation about pertussis, because particularly for people who are grandparents as well and not received one for over 10 years. But that's not funded, unfortunately, and we have to pay for that. And then in the schedules as well that I talked about, just in this bottom section here, it's got the additional vaccines for refugees and humanitarian entrants. And the little table, I think I just got that from one of the Commonwealth documents. And there are just, I know there's certain practices that see more refugees than others, but that's there. And it does say that refugees and other humanitarian entrants aged 20 and older with no documented history of vaccination, they're eligible for diphtheria, tetanus, pertussis, chickenpox, polio, measles, mumps, rubella, and hepatitis B. For children who have arrived into the country as refugee or humanitarian entrants, you just follow the, anyone under 20, you just follow the childhood schedule and the adolescent schedule. And then there's the whole school immunisation programme run out of Cairns North that go out to all the schools. It's a team of nurses who provide vaccinations to year 7 and year 10 students. And in year 7, they'll give Boostrix and Gardasil, which is only one dose of Gardasil now. And year 10, Nimenrix and meningococcal. So that they've had quite a hard time getting consent forms back, and the rates of vaccination, unfortunately, have been quite low over the last few years. So we're just really encouraging all GP practices, if you've got adolescents in there for any other reason, try and hop onto air and get these children caught up. So most of them are only funded up until the children turn, or the adolescents turn 20. I mean, we've just got the Gardasil that's been extended now, which is great. But these vaccines are expensive, and many of these children will be going off to uni, going into healthcare professions or other professions where you actually need to have the vaccines. And it's far better if they can get caught up before they head off to uni or head off travelling or whatever they do. And then just recently, the Queensland Immunisation Programme, it's on their first page of their webpage. It's just under where the schedules are. They've done a really nice document for catch up for high school students or for adolescents, and it tells you how many doses they're due, and it goes into detail about the Hep B, because I know there's different, depending on their age, what documented doses you give of hepatitis B. And so it's quite a clear document. It's quite handy when you're doing an adolescent catch up. I don't know how long it's been there. I only spotted it the other day, but it's pretty good. So there are other funded programmes as well. So anyone born during or since 1966 should have 2 documented doses of MMR vaccine 4 weeks apart. So if you've got people who fit into that category, you can't find any documented doses, they're eligible to have the MMR vaccine. We really want good measles, mumps, rubella coverage in this country. So again, if you've got opportunistic time to look at somebody's vaccinations, that's something that you can offer out of the government stock. And then with hepatitis B, there's quite a list of people who are eligible. And that website that I showed you earlier, the Queensland Immunisation Programme website, that first page, it talks about hepatitis B, and this is just a little snip that I've taken from that page. So low birth weight and preterm babies born less than 2,000 grams or born before 32 weeks, they should have another hepatitis B, paediatric hepatitis B at 12 months of age. And then hepatitis B is also funded for the following groups if they're not immune or not previously vaccinated. And that includes like household and other close contacts of hepatitis B, sexual contacts with hepatitis B, migrants from hepatitis B endemic countries, Aboriginal and Torres Strait Islander peoples, people with chronic liver disease or hepatitis C, and people who inject drugs. So they are eligible for hepatitis B vaccine. And that's listed online if you can't find it anywhere. So a big part of our job at Tropical Public Health is helping with catch-up vaccines. We, Tropical Public Health, produce those catch-up worksheets, which are really, really handy, and we can email, if anybody wants them, we can email them out to you. And we like you to try and complete the section of what's been given and then what you think they're due, and then we'll, if you email that catch-up sheet to us, we'll go through them and work out what else they need, or if it's all okay. The Australian Immunisation Handbook has all the catch-up tables for pneumococcal here. It's got all the minimum dose intervals, how many doses you're supposed to have by whatever age. So it's the more you use it, the easier it is to get used to doing catch-ups. The Australian Immunisation Handbook has the catch-up calculator. I've not got too familiar with that. Some people like it, but it's another tool that we can use. And it's just really important that we catch up with vaccines as quickly as possible. We don't want children out there unvaccinated, exposed to vaccine preventable diseases. So we're more than happy to take your calls and work through catch-ups with you. Something that we've noticed quite a bit of recently is a few nurses aren't happy to give more than a few vaccines at any one time. And it just means that, you know, people are having to have visits and more visits, and sometimes people don't get back if they've got 6 children or troubles with transport. And 6 vaccines can safely be given in this 12-month poster, which is on the far right over there. So 6 vaccines can safely be given at the same visits in that age group. So, and then the poster here, we developed this when the schedules changed in 2020, because obviously we had the addition of the Bexero for the Aboriginal and Torres Strait Islander children. So we just wanted a bit of a visual so that, you know, you can see you can have up to 4 needles under 12 months of age. And you may want to show the poster to parents when you're doing a consultation, parents and carers. And it's important that you try and get confidence at giving several needles in one visit and explain sort of the benefit of protecting that child quickly and not having to come back for subsequent visits. But it's the conversation that you have with the parents. Obviously, you know, we can't, if parents don't want to, then that's their choice. But I think we can inform and give them advice. And I think Sky as well, that's sharing knowledge about immunisation. They have quite a good suite of documents for vaccine hesitant parents and parents wanting to know why they get so many antigens. So you might just want to print some of those off and keep them handy as well. But it's you're the ones that are passing on that information. So you've got to be sort of confident in what you're saying. And another aspect of that is being confident at giving the vaccines as well. So these are infographics taken from the Australian Immunisation Handbook. They have quite a lot when you click on resources, and it has all these infographics. So you just got to make sure that your injection site is correct and you're feeling confident in holding the child, and maybe you might want to speak to a more experienced nurse if you're unsure, because that kind of nervousness with vaccination can rub off with the parents and child sometimes. So you can, there's lots of good information in the Australian Immunisation Handbook as well about giving vaccines, and there's some infographics on how to hold a child. And it's important that you portray a sort of positive image, positive manner when you're vaccinating. So far this year, we've had 114 vaccine administration errors that we've, in 2022, there were 114 vaccination administration errors that we were made aware of. So that's from you guys calling us, or from us going through our overdue notices and noticing that wrong vaccines have been given at the wrong time. And some of the types of things that we see are vaccines not reconstituted, expired vaccines, wrong interval, wrong vaccine, or vaccines given too early. So it's really important that you do your pre-immunisation checklist, you check in what the vaccine that you've got, you check in the schedules, you've got access to the Australian Immunisation Handbook if you need to, you may have certain protocols and procedures that you need to follow. If you're unsure, you can always read product information, seek advice from your colleagues and peers, call us as well, and just the importance of double checking. I know how busy all of you are, and it's very hard sometimes to have those few seconds just to stop and double check yourself, but unfortunately we have seen a fair number of errors. So, but we're always happy to talk you through them. You know, don't feel that you can't ring us. It's better to ring us and we'll talk you through and what we need to do next. And then with vaccination, we do get events, side effects. So if you get any kind of adverse event at all following a vaccination, we really need to know about it. And that it's good information then for the pharmaceutical companies to know what sort of reactions are happening with their vaccines. The adverse event form, it's on that Queensland Immunisation Programme webpage. I've just done a little snip of those two web pages because at the moment there's still one for COVID and one for non-COVID vaccines. Hopefully they'll all be one again soon, but it's just on that Queensland Immunisation webpage, and we need to be notified about those. We'll then call you, we call the patient, and then we send all that information back to Brisbane, and I think that information goes off to the TGA. So it's a bit of a pain sometimes when you've been busy and you've got a reaction. They can take a bit of a while to fill out, but please do fill them out. It is very, very important information for everybody. So in July 2021, it became mandatory to report National Immunisation Programme vaccines to the register. I think everyone hopefully should be familiar with AIR and have their HPOTS logins. While it's not mandatory to report non-NIP vaccines, we really encourage you to. So any travel vaccines or any kind of additional vaccines that your patients have, it's where the source of truth is. It's where they can go onto that register and know what vaccines they've had if they're travelling again. So please, even though it's only mandatory for the NIP vaccines, we really encourage everyone to add all of the vaccines onto that register. So don't assume that all data is on AIR. It's really important that you check your medical software. We've had people ringing us up and say, well, it's not there, and then they've gone back through their software. You know, AIR hasn't always been around. You know, it's not always 100%. So just double check if you're doing someone's history. Check your own software as well to make sure that it matches up and that that they've not vaccines missing on AIR. And then just ensure that your HPOS login is up to date, that you have access to directly enter into AIR, because a lot of people within GP land now, you can go directly into AIR through your best practice, or you can just click on the patient, but it's important that you still have your HPOS login as well. I don't quite know how it works with best practice, but I know some people haven't been able to email AIR that way, but then they've forgotten their HPOS login. So just ensure you keep your logins up to date. And when you add in overseas histories, it's very time-consuming, painful job. But if they come from a country where they don't have Infinrix Hexa or the vaccines that we have, you actually have to add them in as generic antigens. So if you've got an Infinrix Hexa, you actually have to type in generic Hep B, generic tetanus, and so on, and you end up with a really long vaccination history. But it's the only way to do it, unfortunately. So and again, we want people to have accurate vaccination histories, especially when we've got little children coming over as well. And also just be really careful with your dose numbering, because incorrect dose numbering, it shows that they're not up to date when they actually might be up to date. It's just that the dose numbering might not be correct. And I just wanted to mention that AIR, it's a Commonwealth database, so it's not a catch-up calculator, it's just a database. Only certain vaccines will appear as overdue. So they might be overdue other vaccines, but it might not necessarily say that. In particular, your First Nations vaccines or anyone who's due any kind of additional vaccines because they're medically at risk, AIR won't ask for those. So don't expect to get a full, when it says due, don't expect to have a full catch-up sat there waiting for you. You still need to refer to your Queensland Immunisation Programme schedules and they're medically at risk, you need to refer to your target statements and look in the handbook. So it is just a database, it's not a catch-up calculator. We're finding that Pneumovax 23, given at 4 years of age, is appearing as dose 5, but it's not dose 5, it should go in as dose 1. And just be careful when you generate an immunisation history. So that's because when you generate your immunisation history, it only shows vaccines that have been accepted. You need to click and open up the full history, look down, because there might be vaccines that are partially processed or not being approved by AIR, but where if you go into the immunisation history statement, you're not getting a full report. So when you're working out a catch-up or working out what they're due, just always click on that little down arrow and get the full history. And this is what an overseas history looks like for someone who we had to type in, or you guys had to type in. You know, normally we'd probably just see that as an Immuninix hexa or a few Immuninix hexas, but because they're overseas, it was a different brand that they used. So you have to type in generic and make sure you add correct dose numbers when you do that as well, because they're pretty messy histories, but it's just really, really important. And then Queensland Immunisation Programme have a suite of courses, one on vaccine preparation, one on the programme, and one on vaccine development. They're free, and if you're feeling like you're not, you need a bit of an update with vaccination, there is one on cold chain, which we'll mention in just a moment. But if you want to update yourself, and they'll all go towards your CPD. That's me. So Nancy is going to talk about vaccine management and cold chain, and then we'll do the questions at the end.
Thanks, Ange. Thanks, everyone. Definitely thanks, everyone, for coming tonight. And thank you those that have joined in online. I have been trying to open up the chat online, but I haven't been able to do it. So sorry about that. If you're joined us online, you can always drop us an email if there's any questions that you have. But hopefully we'll have lots of questions in this room full of people that might answer what questions you have at home. So those that don't know me, I'm Nancy. I'm one of the public health nurses doing immunisations, currently doing the Connecting Our Mob project, but definitely have been involved in immunisations for many years, and I love cold chain, which is really scary. So I'm going to quickly give you a quick update about cold chain. So vaccine management, cold chain, we're still using our National Vaccine Storage Guideline, our 3rd edition, which came out in 2019. So everyone should hopefully have one of these books. If not, come and see us. We can definitely get a book for you. What has changed? So that's been going on for a few years now. What has changed has been that the Queensland Immunisation Program has brought out a new vaccine management system called VMS. So that hasn't affected you guys too much. It's more about ordering your vaccines, but it definitely has affected the public health units and Brisbane and the Queensland Immunisation Program. There's been new and improved thermostability data that was released by the Queensland Immunisation Program, which is confidential, that we use, and that data includes cumulative times of exposure. So as a result, we're asking you guys for so much more data, and we want everything. We're really hungry for all that lovely data that we're asking for you to collect with a cold chain breach if you unlucky to have one. So any temperatures that are outside of the recommended temperature range of +2 and 8 degrees need to be reported. So the only ones that don't need to be reported are the ones that got to less than or equal to 12 degrees for less than 15 minutes when you're stock taking or restocking. So if you had a cold chain breach overnight, you come into the fridge in the morning and your fridge got to 9 degrees overnight. You're not sure, maybe it was just a power blip and the power went off and it was for 10 minutes. That's a cold chain breach. You do need to report that because it wasn't for stock taking or restocking your vaccines. So you do need to let us know. Thus far this year, Tropical Public Health Services have managed 22 cold chain breaches. This time last year, we had managed 25 cold chain breaches. And of the 22 we've done this year, 15 of them have been due to power outages. So we do know power failure is a common one that we get. There have been 2 that are fridge malfunctions, and we still have had 5 that are human errors. That could be that the fridge door was left ajar, or when you're stock taking and restocking, might have had the fridge open for a bit too long, greater than that 15 minutes. So vaccine management, it's all about striving for 5. We need to store our vaccines only in purpose-built vaccine fridges, which have to be continuously monitored. We need to have staff that are nominated to be responsible with vaccine management, and we need to have backup staff members to be responsible when that lucky staff member manages to get the annual leave that they all should be having. We need policy and procedures for vaccine management. That's your vaccine management protocols. Everyone needs to know their vaccine management protocols. All staff involved in vaccines need to be adequately trained. So it's not just the nurses. Doctors need to know about vaccines. Your admin officers, they receive those boxes that come full of vaccines, so they all need to be trained what to do. And everyone should have some sort of, knowledge of your vaccine management. There should be a self-audit done every 12 months, and that's in your National Vaccine Storage Guideline. Check and record your vaccine fridge needs to be done twice daily. We need to check the current temperature, the minimum and the maximum temperature, and record those on your min-max charts, whether it be your Queensland Health one or your Strive for 5. You need to have a plan for cold chain breaches and power failures, especially your power failures up here. And of course, report all cold chain breaches that were outside of the 2 and 8 degrees, and the only exception is for stock taking. Always strive for 5, that's our middle range. And if you have had a cold chain breach, do not discard your vaccines and do not use any of the vaccines. You need to keep them isolated until you get advice from Tropical Public Health Services. And follow the guidelines for packing and monitoring vaccines in a cooler, and that again is in our lovely Strive for 5. So for Queensland Health facilities, for all CANS HHS facilities, your fridge manufacturer guidelines and the current National Vaccine Storage Guidelines need to be kept with your purpose-built vaccine fridge, either on top or really with the fridge. And that's quite important for anyone who's been doing their cold chain audits. Takes a while for this to go on, because the other thing is we need to ensure that all CHIS facilities also have BEMS BEMS or the clinic completing the routine maintenance checks and signing that maintenance sheet. Queensland Immunisation Program have recently developed a vaccine management protocol template. So if you are looking at updating your vaccine management protocol, reviewing it, which you should try and review at least every 12 months, or if there's been any changes, and you would like to have a look at the template, we definitely can have that emailed out to practices, and yeah, you can just fill in the sections that need to be filled in and send it back to us for reviewing. But they've made it so it's a bit more statewide, everyone's saying the same thing, which is all from our lovely Strive for 5. As for CHIS facilities, there is a vaccine management protocol and workplace instruction that's available on QEPS. The vaccine management protocol, your workplace instruction, each facility has their own workplace instruction that works alongside with our vaccine management protocol, because there are, obviously all different areas have different staff members responsible for vaccines. Fridges could be a little bit different. Your equipment could be different. You're definitely storing your Eskies and your ice bricks in different areas, because not everyone will probably have the same tea room. So ensure that all our CHIS facilities have that workplace instruction and protocols available. and that all staff are aware where they are and where to find it. So why do we even bother with cold chain? We know vaccines are very sensitive biological substances and they can become less effective or even destroyed if they're frozen, allowed to get too warm, or exposed to sunlight, UV light, or even fluorescent light. And as health professionals, we really have a responsibility to ensure that we're giving our clients effective and potent vaccines. There's no point giving a vaccine that has been frozen and then you don't know that, you can't tell that it's frozen. That's why we need to make sure we monitor our fridges, because it can then defrost and you'd sit there going, oh, it doesn't look frozen, whereas it's already been frozen and is no longer effective. So it's really important to do our cold chain. Vaccines can be expensive. They are expensive and they can be in short supply. So we can get shortages of vaccines, and good management does eliminate the need to revaccinate. We have had, historically incidences where we've had to revaccinate due to cold chain breaches. And cold chain breaches do occur even with good procedures. So it's fine for cold chain breaches to occur. What we need to do is just make sure they're detected quickly and we're not giving any ineffective vaccines. So we do know we're going to get cold chain breaches. We just need to know what to do when it happens. So we need temperature monitoring equipment. At a minimum, all vaccine fridges have to have your built-in thermometer and a basic data logger to continuously monitor refrigerator temperatures. So they all need to have that data logger as well as your min-max fridge thermometer. At a minimum, you have to do the twice daily current minimum and maximum temperatures and record it on that temperature chart. And your data logger must be set at a minimum of 5-minute intervals. So we have had some that were set at 10-minute or 15-minute intervals. They need to be changed. They have to be set at 5-minute intervals. And again, all staff need to be trained how to operate and manage the min-max thermometers, data loggers, and interpret the readings. So again, very historically, we have had, a staff member that was recording min-max temperatures and doing it diligently, but not really interpreting the readings. So although they were doing the min-max thermometers and they were doing the right thing, it was not between 2 and 8 degrees. So you really need to make sure everyone interprets the readings. This is our Queensland Health min-max temperature chart. This is how we would like it to look like, with your minimum and maximum and the current temp recorded. Have a signature of whoever recorded the temperatures. The time is also written up there. You can see there's that one date there on the 13th where the temperature was above 8 degrees. So that's like, oh, what's happened there? And hopefully, if you turn it around, the vaccine troubleshoot will be filled in. So that's where it got up to 10 degrees. And that was due to restocking. The door was closed and it was less than 15 minutes. So that's all been signed. So then we're happy with looking at that. That's how it needs to look like. If you do get a cold chain breach, you have to report the cold chain breach online via the cold chain breach reporting form. We used to have a phone number for the Queensland Immunisation Program unit. There is no longer a phone number. It is only an email, and you do need to use that reporting form. If you do get a cold chain breach, you need to keep those vaccines, if possible, between that 2 and 8 degrees and report the cold chain breach as soon as you can. That's what the cold chain breach report form looks like. So if the power goes off or the fridge malfunctions, so we've had a lot of people sit there going, well, we're not too concerned about getting coolers or, our ice bricks, because we've got a generator and we've got the UPS, our backup power supply. That's all well and good. You probably don't get power failures, but you can still get fridge malfunctions. So everyone really needs to make sure they have the equipment to deal with a cold chain breach. But if your power does go off, you do need to immediately isolate the vaccines, keep it between 2 and 8 degrees, and leave them in your vaccine fridge. put a sign on the fridge door, because there always could be someone that comes and tries and grab a vaccine out of there to say that the power is out. Closely monitor your vaccine fridge, and if needed, there are some purpose-built vaccine fridges that do not have a temperature that shows the temperature when the power goes out, so you will need a min-max battery-operated thermometer so you can see what the temperature is. And at this stage, you should be running to get your coolers ready, get your eskies ready, because most fridges take 15, 20 minutes, depending, to get above 8 degrees. So you don't have long to get those eskies ready, get your ice bricks wetted. Hopefully you've got people to help, so someone can investigate to see why the power went out, and have other people start preparing the eskies. If the temperature does get to 8 degrees, it's now time to move the vaccines. Here's the trick. Don't move it into an esky that is at 20 degrees because your fridge is at 8 degrees. So you only move it if your eskies, your coolers, are at 8 degrees or less. So although, that's written there that, yep, time to move your vaccines, your fridge has got to 8 degrees, keep it in the fridge. The fridge is not, it's the safest place, it's monitored, and only move it once your coolers are, to your 8 degrees or less. There's no point moving it from a cool fridge to a warm esky. We do recommend you keep your battery-operated min-max thermometers with your vaccine fridge and your coolers so they're ready to use. Again, make sure you're checking that min-max thermometer every 12 months, do your slush test and change your batteries so they're ready to be used. And if vaccines are exposed out of the temperature range of 2 and 8 degrees, then you do need to report a cold chain breach when everything is settled. So we expect if you have a power failure, you do need to do all the processes. And once you're hopefully back to normal, you give us a call or email Brisbane and let them know that you've had a cold chain breach. Big thing is don't panic, take your time. Don't move your vaccines until you're fully prepared. Keep the vaccines as safe as possible. And documentation is really important. We need that correct documentation so we can also give the correct advice. We need to know what time that power went out, what the temperature of the vaccine fridge was when the vaccines were moved. So this might seem very overwhelming because you're sitting there going, okay, what's the fridge temp as we're moving the vaccines? But you've had a look and the fridge is sitting at, 10 degrees and your eskies now sitting at 6. Start moving your vaccines, document what time you're doing it, because you should have that data logger in your fridge. The data logger, we can correlate the times with the data logger and what times you've written that you've moved the vaccines into the esky. So just document, as more documentation, the better. So everyone needs to ensure they do have alternative storage. So there needs to be sufficient digital thermometers, eskies and coolers, bubble wrap, ice packs and gels, and your logbook. So we're coming into the influenza season. You're going to have more vaccines in your fridge, heaps of flu vaccines. You need to make sure you have enough space for packing the flu vaccines plus your nip vaccines plus any private stock that you might have. Another alternative is our soft packs, which we did bring last year. I've brought it again this time round, so if anybody wants to have a play and look at it, we do have that to have a look at. They're really quick and easy to use. You don't need to condition those ice bricks. It's just putting those sheets of ice in and putting your thermometer and waiting for it to get down to the correct temperature before you can move your vaccines into it. Have your vaccine management resources, your min-max thermometers, your min-max temperature charts, your logbooks, our storage guidelines, stickers. So if you need any of these resources that are on this screen, you can always come and ask us. We definitely have them in stock and can send them out. We've even got the emergency vaccine storage sticker for your coolers, just to give you prompts. Lots of information on the Queensland immunisation schedule. online on Queensland Health, so you can go through that. That has your cold chain breach form as well. And as Angie spoke, there is that Queensland Immunisation Program course, which does have a nice short little 3-minute how to pack a cooler, which is great, you know, to practice. It is great to show any new staff members and just refresh yourself every now and then, or even collect your empty vaccine boxes and practice packing a cooler yourself if you feel like it. I enjoy doing that every now and then. I ask people to collect their boxes. So just quickly, we also are planning on producing a sticker for the personal health records for children that require or are recommended to receive extra vaccines. And we just wanted everyone's opinion. We wanted feedback. We want really to know what your thoughts are, if this is a great idea. It's just a little green sticker that we want to put, and the reason we picked green is for Bubba Jabs. Everyone, Bubba Jabs was produced here in Cairns at Tropical Public Health Unit by our lovely Romany, and has now been taken up statewide. So it is used statewide. So it is something that is recognised, that colour, and it really is extra vaccines that are required. So it's more of a prompt. We haven't written down what vaccines are required. It's a prompt for the doctor, for the nurses, even for the parents, so they can look at it and go, oh, I've got that sticker and there's a tick, so that I need to ask more questions. Again, any feedback is welcomed. So I do know that our lovely Kathy is walking around with a QR code online. If you can scan that QR code, and yeah, we're open to any feedback at all. And that's it. So it's question time. Now, those that are online, we do have a feedback form, and we do as well for everyone here. If you're online, the feedback form is going to be coming up because Raj is going to put it up for us. And if you need to complete the feedback form for you to be able to get your certificate for the Primary Health Network to be able to send out the certificate. Is that okay, Raj? Perfect.
Sorry, any questions, anybody?
And it doesn't even have to be just questions for us. We've got some expert doctors as well around. And anyone? Angie, I think you spoke so well. Everyone doesn't. No one's got a question for us.
All right. Well, that's it then. Oh, good. Well done.
Thank you.
Thanks for that.
Thank you. So online, Raj, have you got it up online for everybody? Sorry, I can't see it on this side.
And this session will be recorded and available next week on the Primary Health Network website as well, for anyone who missed it.
Oh, perfect. Excellent. So yeah, online, if you can do that survey, that's how you're going to get your certificate. We've been promised that's how you get certificate. Thank you all. Thanks, everyone. Thank you.
Raj.
Yes, big thanks to Raj and big thanks to the Primary Health Network and to our team. Just give them a few minutes just to see if they, yeah, only because of that questionnaire. And anyone online, if you want any resources, again, just email the tphu_CDC_IM at health.qld.gov.au, and we'll send out, we can discuss resources, send out what we've got. Thank you, everybody.